Good afternoon and welcome to our live stream today here at Stony Brook Medicine. I am joined with two phenomenal thought leaders in the healthcare space, and we're going to have a panel discussion today on disruptive innovation and really talk about strategic planning in healthcare and education and how that is requires change and new thought leadership. One of the things we're going to talk about is strategic planning and just all the disruption that there is in the industry right now. We'll discuss how we need to embrace transformation, change, and how to positively disrupt systems, processes, and strategies so that we can reinvent our organizations and our brand, and how we can stay relevant in the healthcare environment. Innovation is a very important component of this as well. And so we will spend a little time talking about innovation and what that looks like in terms of creating a new mindset within your organization for culture change. Other areas that we're going to explore will be related to organizations and how they need to evolve differently in the healthcare ecosystem that we're living in today. And how can we embrace technologies such as AI or other technologies as we think about our workforce, as we think about economies of scale, and as we think about how we make sure we have the right systems and processes for our workforce as we move forward. We're also going to talk a little bit about the education space and how we need to think about our life science schools and academic medical centers and how they play a role in shaping the future healthcare workers, as well as their mindsets, thought processes, as well as adoption for technology, disruption, and innovation. If you have any questions throughout this day, please use the QR code on the screen and submit your questions through the forum, and we will do our best to address everything we can today. I appreciate my two guests today. The first is Dr. Hal Paz. Dr. Paz is our Executive Vice President for the Health Sciences at Stony Brook University, and he's also our Chief Executive Officer for Stony Brook Medicine. We're also joined today by Dr. Zeev Neuwirth. Dr. Neuwirth is the Chief Clinical Executive for Care Transformation at Atrium Health, and he's also an author of a book called Reframing Healthcare and a speaker and podcast host. So I'm going to start with a handoff, Dr. Paz, to you and ask that you just share with the audience a few comments about disruption, innovation, transformation, and how do you see that in this space?
Yeah, so thanks very much, Liz, and delighted to be with both you and Zeev this afternoon. First, I want to maybe put a context around this, which is where are we in the scheme of the evolution of health as we know it today? You know, the roots of all this go way back to a century ago, where the current medical model was developed back around the turn of the 20th century. And a lot of that work happened when there was an observation that to train physicians, medical schools and training facilities needed to be attached to universities. And in fact, one of the early models of its day was Johns Hopkins. And we're all very familiar with Johns Hopkins medicine. But that really came out of this report from Abraham Flexner, that defined this medical model. And that medical model has carried us literally for a century, where research would be developed in the laboratory, translated to the patient bedside. Medicine was rooted in inquiry and science, and all the advances that we've made, which have been remarkable advances in extending life, improving health and well-being, were really built off of this model. And with that came many, many things. The rise of the modern American hospital, which we know today, even in a certain respect, the way we pay for healthcare, fee-for-service payments. There was no health insurance as we know it now. Back at that time, insurance was really covering you for something catastrophic. But over time, that developed as well. There were early models in California like Kaiser, the Blue Cross model that developed in the first half of the last century. And then, of course, in the 1960s, the passage of Medicaid and Medicare, which really created this enormous expansion of reimbursement. But in large part, this was all predicated on fee-for-service reimbursement. In around the early 1990s, Mike McGinnis and colleagues developed this paper and concept of determinants of health. And these folks, that many of them went on to the Robert Wood Johnson Foundation, defined health as being determined by genetics to some degree, by healthcare, but also by social, behavioral, and environmental determinants of health. And it was really the first time that there was a thinking that goes beyond the traditional medical model as regard to what we do to someone using drugs or hospitalization or various types of innovation, and really thinking more holistically and more broadly about an individual's circumstances. And with that, and it took literally years and a couple of decades to evolve, we have a much broader definition now of health and well-being. How do we avoid premature death? And we know that it extends beyond just simply healthcare per se. In the first part of this century, it was really the influx of technology that had a tremendous impact on many, many other industries. And healthcare, to some respects, was later in coming to the use of digital technology and telemedicine, and an array of different innovations that could drive and expand access to care. And then finally, most recently, the third challenge that we have seen, or the third situation, is the issue of workforce. The recognition that there are huge demands in terms of health and well-being. We have this aging population in this country that is unprecedented. We have an increased burden of chronic illness because of the success of the medical model in preventing premature death for many individuals who have had devastating illnesses like cancer, for example, or need a transplantation. But as a result, there is a demand for more and more healthcare services, and the recognition that we have to find ways to provide care for these individuals, and that right now, in this day and age, particularly in this post-pandemic world, there are huge challenges in terms of workforce as well. So all three of these things have come together: the determinants of health, the use of technology, digital, AI, machine learning, as well as telehealth, and now the issues around workforce that are causing this enormous change, a once-in-a-century change, in fact, on the way that healthcare is going to be delivered and healthcare will be paid for.
Great. Thank you for those opening comments. I really appreciate that. And you've really shared a great history and a great perspective on how that has shaped the processes and systems we have today, and also set a few examples of how we might need to think about that and change that in the future. So I appreciate that. Dr. Neuwirth, let's turn to you. I'd love to hear your opening comments and thoughts related to the topics that we're discussing today.
Yeah, so first of all, Liz, always a pleasure to speak with you. And I just want to say it's always a privilege to be speaking and listening to Dr. Paz, just one of the most erudite and wise leaders in our country. I've had the privilege of interviewing Dr. Paz on my podcast, and just brilliant. Let me pick up on what Dr. Paz was saying, because I think it needs to be underscored. We are living, and most of us are just not aware of this in healthcare, because we come to work every day, we do our job. Our jobs are extremely complicated. We're talking about people's lives that are in our hands and our systems, and so we don't have the luxury, most of us, of looking up and really understanding the circumstances that we're in. But from my perspective, and I've been studying this for some time, is that we are living in I think what Dr. Paz is sort of getting at, we are living in a new era. We used to live in an era of incrementalism, what you might call the era or age of reengineering, where we would make small changes in how we delivered healthcare. But that era is way over. I would say in the last 10 years, we are in this new era of reframing. And this era, this transformation of the healthcare industry, and it is a transformation, nothing less than that. It's not isolated to healthcare. So if you look at, and all of us are aware of this on one level or another, but if you look at other industries, they've all gone through, this once in a century change that Dr. Paz was talking about. If you look at information, I mean, think about how we used to seek information 10, 15 years ago versus how we do it now. I mean, the truth is, Google has become a verb. My kids don't have to look anything up. They just Google it instantly. And now with some of the new, if some of you may be familiar, literally in the last month, Chat GPT just came out. This is a revolutionary artificial intelligence that not only can provide you information, but could literally write essays, write poems, do research, write songs. It is going to, the era of information has been revolutionized and continues to be in that space. Think about retail. Think about the way you shopped 10 or 15 years ago. Right now, shopping is literally going onto your laptop or iPad or your device, your phone, going to Amazon and ordering whatever it is you want, from shirts to shoes to technology to house goods, and having it delivered within hours or days at the most. Retail has been revolutionized. If you think about travel with Uber, you think about, you book a vacation now. Airbnb has become a verb. Airbnb is larger than all the other hotels put together. So travel, commerce, banking has been revolutionized. Think about the way you do banking now. And so all these other industries have gone through this incredible, as Dr. Paz was saying, part of it is digital, part of it is about a change in workforce. I mean, think about all those bank tellers, think about all the people in retail. That's all been transformed. Healthcare is going through the same exact type of transformations that all the other industries, or most other industries, have gone through. And by the way, we're not at the beginning of it. It has been going on for at least a good 5 to 10 years. The things that are driving this are very, very real. This is not because someone, at CMS or HHS or someone at the federal level or even at the state level decided we've got to change healthcare. The forces are unbelievably powerful, unbelievably real, and unbelievably urgent. They're both internal forces and external forces. The internal forces are some of which Dr. Paz was referring to. We have a challenge in healthcare. Healthcare is clearly unaffordable for, I would say at this point, the majority of Americans cannot afford healthcare. One hospitalization puts a significant portion of the population, and I'm not talking about the uninsured, and I'm not even talking about the underinsured. I'm talking about the majority of working Americans cannot afford healthcare today. It is not convenient. It is not accessible. Dr. Paz mentioned another things in terms of the social determinants of health, the inequities in healthcare. It simply has to change from an internal perspective. And then think about the issue workforce, about burnout. So literally 50% of providers are burnt out. 1 out of every 2 providers. Not a sustainable model, not a desirable model. So we have these internal forces. On the external side, because of the inefficiencies and the costs, the inconvenience, the inaccessibility of healthcare, other industries, and we can get into this, Liz, in a little bit, other industries have been entering into healthcare in a major way. And we're talking about competitors and disruptors as large as Walmart, the largest retail chain in the world, Amazon, and we could talk about this in a moment, but you have these external disruptors, and then of course the thousands and thousands of smaller tech disruptors and digital disruptors. So you've got both external and internal disruptors. And finally, by way of introduction, let me say that I don't think this is a bad thing. Most of us, myself included, are not particularly wired for change. Change is got danger with it. It's risky. It's unknown. We'll hold on to what we have. That's for the most part, that's human nature. But as I see this change, and although it's going to be difficult, I'm not sugarcoating in any way. I actually think it is the right thing for our patients. It's the right thing for their families. It's the right thing for our communities. And quite honestly, it's the right thing for our country, and even on a global level. And in addition to being the right thing for patients in terms of proving affordability and access and outcomes of care and costs, in addition to that, I actually think it's the right thing for doctors and nurses and other providers of care. We are working in a system that is incredibly, incredibly tough to work in. And I, for one, would welcome some disruption that would make it easier to provide the type of care, quite honestly, that we all want to provide for our patients.
Thank you so much, Dr. Neuwirth, for those comments. In my role, one of the things that I talk about a lot with different audiences is what is strategy. And strategy is really the things that you choose to do or you choose not to do that will differentiate you from the other competitors you have in the healthcare space. And as you both mentioned, there's a lot of disruption. There are a lot of different organizations out there, and consumer expectations are changing every day. Convenience, access is all very important. So let's talk a little bit more about some of those disruptors, and how do you weed out the disruptors that you need to pay attention to versus those that are just creating noise and disruption for disruption's sake? How do you channel your organization's transformation processes in a constructive way and in a way that really helps you build towards something better for the future? Dr. Paz?
Yeah, so thanks, Liz. And I definitely want to just, again, agree with, so many of Zeev's observations and how what we're seeing mirrors and parallels other sectors of the economy in many respects. And as I see this, it's really going to be the patient, or as many call them now, consumer of healthcare, that'll be the decider as to which of these get weeded out and which don't. That's not for us to say. I think the market winds up ultimately saying, does this create value? And value is defined as, does it help an individual achieve their own personal health aspirations? Because first and foremost, that's critical in any of this. And second of all, can it do it in a way that achieves value? And some of these new innovations, some of these new approaches, if it helps people live a longer and a healthier life and a more fulfilled life, and they can access it and afford it, I think it's going to have enormous durability, no doubt about it. Many will not. And many are challenged by three issues. First and foremost, it may be a great idea, but if you can't scale it, it doesn't really achieve the presence in the market that it needs to have. Second of all, is it interoperable? Does it wind up attaching itself and interfacing with other healthcare solutions that the individual patient needs to have addressed? The ones that can do that exceptionally well are the ones that have a greater likelihood of success. And third, and most importantly for many, is does it have a value proposition? Is it affordable? And if it's affordable, someone will continue to use it. If they don't, it will not have persistence. And all of us that use apps know all about persistence. We have apps that we go to every single day. Zeev mentioned a few of them in retail and in banking and even in checking the weather. My phone, I'm sure like everyone else's who's watching today, has a number of apps that'll either self-disappear in a few months or I'll just get rid of, because they don't achieve those three propositions that I mentioned. They don't interface well, they don't achieve value, and they don't have a meaningful impact on my life. And I see that with a lot of the healthcare, quote unquote, disruption out there. On the other end of the spectrum, going from the individual to established traditional health systems like the one that I lead here, Stony Brook Medicine, or the one that Zeev is with, the situation, I think, is somewhat different. We look at it from the lens of providers. And the argument that I would make for an organization like ours is, how do we transform what used to be a hospital 20 years ago, which today is a health system? We have 4 hospitals here on Long Island. We have over 200 outpatient clinics across Long Island. How do we move from being that health system to becoming a health platform that is virtual, that is digital, that has mobile solutions where we bring care to you at the home, but it allows us to address the needs that you have first and foremost in your home, leveraging assets and resources in your local community, nonprofits, agencies, NGOs, whatever the solutions are, to help you address and to help you achieve your aspirations for better health and for longevity. And if we can do more and more of those things near you, we can create a personalized health experience that addresses social and behavioral and environmental determinants of health that you feel is tailor-made and curated for your needs. We are going to be a better and more effective health system. And that also means that we can address issues around access to care, because we can bring the access to you. We can reduce the number of patients that have to come to our emergency department because they don't have access to primary care. We can decompress areas that are compressed today because of the way that the health system in many parts of this country is designed. And if we do that well, that means that our workforce is less pressured. And Zeev mentioned a number of examples of how our doctors and nurses and other clinicians feel enormous pressure because of the demands that are placed upon them because of issues around access to care and limited resources in other places. Now, all this sounds great, but we have a couple of challenges. One is the way that healthcare is paid for today. In a fee-for-service environment, there are frankly disincentives to think about ways to deliver care in areas that are not currently reimbursed or poorly reimbursed. Most hospital systems in this country operate on very thin margins. Many rural hospitals, community hospitals, and safety net hospitals don't even have positive margins. So for them to think about doing these types of innovations is incredibly difficult. It's financially challenged, and it only will create situations where their financial situation can worsen. If they can be paid for creating this value, if they can have value-based reimbursement models that reward their success and better outcomes for the populations they serve, this is going to be much, much easier to get to. Second of all is this issue of interoperability. We have a number of different partners, and many systems around the country are partnering with new entrants into the market, and there has to be an opportunity to create a seamless health record, seamless interoperability of health information. If you're operating a clinic somewhere, or you have a partner that's driving mobile vans around your region, but the systems are not enmeshed and are not communicating and are not patient-centered in terms of the health information that is being exchanged, it makes it very difficult to make these types of platforms successful. And then last and very importantly are all the regulatory issues. In many states and many communities, the regulations, the laws that were designed appropriately for hospitals and for a different set of circumstances decades ago make it difficult, quite frankly, to create these types of partnerships. And we do need to be mindful of the importance of all the issues that those rules and regulations and laws attend to. But in the current world, some of them create constraints for creating durable partnerships into the future around how patients are referred, how patients are managed, how dollars are exchanged. So we have to have a rethinking of that. Again, it has to be prudent and it has to be appropriate, but at the same time, we have to continue to evolve, and it's going to be necessary to take a look at how all that works in the current environment that is undergoing this enormous transformation.
Thank you for that. Zeev, why don't we talk a little bit about the disruptors and what challenges do they face? We're talking about the challenges that we as providers are facing. Let's flip that to the other side of the equation and talk a little bit about, as you have talked with many in the industry, where are some of those challenges in terms of being relevant and having those value propositions that Dr. Paz talked about?
Yeah, no, I'm happy to do that. Liz, if you don't mind, I'd love to pick up a little bit on your previous question, and I think what Dr. Paz said is just amazing. I hope this is being recorded. That was worth recording. You asked the question about strategy, and I think in competition, and we're talking about the disruptors. Jeff Bezos, the previous CEO and obviously the founder of Amazon, he's well known for saying that he did not compete, right, with competitors. He did not focus on what others were doing. What he focused on was the consumer. And, Amazon, many people don't know this, and you could Google it and look it up, but Amazon mission is to be the most consumer-centric organization in the world. They have 14 leadership principles that Jeff Bezos and his initial leadership team created, and they talk about this constantly. And I know this for a fact because I've done some work with Amazon, and when they meet, they talk about their 14 leadership principles. The first is about the consumer, telling stories about this consumer, understanding consumer. I think that is a big inflection point for healthcare delivery. And I'm not talking about the doctor-patient relationship. When a patient walks in the room with a doctor, I'm assuming, and my experiences in the literature would tell you that, there is a tremendous amount of obviously attention on that person in front of you. But at the system level, at the healthcare delivery system level, I think we have to, there's no question, as Dr. Paz was saying, there are so many operational and financial and technologic challenges we have and constraints, and we have to work within them. And that is our job. And at the same time, I think we have to start to think about the patient consumer in a different way and begin to really attend to their needs. We have to make healthcare much more relevant. I think we have to make it much more engaging. I think we have to make it much more affordable and convenient and accessible. And so, you know, as I've talked to leaders across the country, and as you know, Liz, I've been interviewing healthcare leaders for the past 7 or 8 years and posting those dialogues in my podcast. There are a few phrases that I've sort of picked up, and this is not one organization, but there are monikers like people, you know, there's this sort of thing of care for me, right? So obviously provide care. But another part of it is also guide me. The system is incredibly complex. I need a trusted guide. I need trusted information. Because the system is challenging for everyone, you know, part of it is also ease my way. And then finally, people want to be known. They don't want to be generic patients. They want to be known as individuals and have personalized care. And so I think for us, you know, in terms of how do we set a strategy, which was your question, I think we set a strategy by refocusing on our consumers. And by the way, there's lessons we can learn from other industries, even something basic as segmentation. And Liz, you and I and Dr. Paz have talked about this in the past, the notion that we tend to treat, you know, people more broadly, but you know, the idea that, you know, a senior, someone who's 75, 80, 85 years old, maybe they need a different type of care than that 25 or 30-year-old. And so when you look at your system and you ask yourself, how are you differentiating care? How are you creating care for someone who's 75 or 80 versus someone who's 25 or 35? Because there's no way that they need the same type of care and the same protocols. And so again, I think that refocusing on the consumer is critically important. The disruptors know that. There are 2 or 3 major disruptors in the market. One set is the retailers. As I was mentioning before, Amazon, Walmart, Walgreens, CVS. These are huge, huge retailers with revenue in the hundreds of billions of dollars a year. They've been doing customer service for decades, and they understand how to study the customer, how to learn what the customer needs are, how to create something that customers want, how to engage customers, how to have customers keep on coming back to them. They're all getting into healthcare in a big, big way, investing billions and billions of dollars into healthcare. The other set of disruptors are what we used to call the payers. So Aetna, Humana, United Health Care. Traditionally, we call them, you know, insurance companies or payers, but let me just dispel that myth, because there is no such thing as payers anymore. They are all becoming payviders. That is, they are payers and they are providers of care. In fact, Optum, as we know now, United Health Group, is the largest employer of physicians in the country. CVS, Aetna, has tens of thousands of providers that it employs. Humana, the same thing. So they're no longer insurance companies. This group of entities are at a minimum, they're payviders, but the truth is they have many, many more businesses built into them, like PBMs, obviously their insurance arm, their provider arm, their analytics and consulting arms. And so again, there are multiple businesses rolled up into one. So they do have some advantages in terms of multiple revenue streams, in terms of their size, in terms of their consumer orientation. I would say this, the one advantage they don't have, which hospital systems, academic medical centers, healthcare systems have, is they don't have a trusted relationship, a trusted brand in the communities, which we have been building up for decades and decades and decades. Patients, people, families, employers, communities have been coming to us for decades, and we have been delivering the best care possible. And we have built that up, that trust, that credibility. We have become part of those communities. I think that is our secret sauce. And And so, and that, the Amazons of the world, the Walgreens, the Walmarts, even the payers, they don't have that. I think it is one of our great advantages. I think it is an advantage that we need to double down on. We need to really remind folks, and I've seen hospital systems really beginning to do this again, reminding folks, we've been here for you. We're here 24/7. We don't shut our doors down. We take care of all sectors of the community 24/7 and 365 days a year. And we've been doing this for a long, long time. And so turning it from instead of a disadvantage for the disruptors, I think it's a major advantage for us that we should be proud of, but we really, I think, can't take for granted. I think we really have to. I think we have to actually up our game, if you will, on that trust card and that trusted brand card.
I love that. Those are great comments. The insight in those comments are wonderful. And we have been talking about this a lot in the healthcare space, and a lot of conferences are talking about this topic as well. I'm going to switch to some questions we've got from our viewers. And again, if you would like to pop a question in the chat, please do so. And our moderator behind the scenes will make sure it gets up on the screen in front of me. There's the QR code. This question is about quality. So I'm just going to read what they put in the chat. Thank you for all of this talk. From a grand perspective, we rank among the 14th high-income nations, among the 14 high-income nations in terms of access and outcomes. Our consumption's out of control, right? It's 20% of our GDP. At the same time, it seems like everyone and their cousin is winning awards for quality. And it seems misaligned to this viewer. And I agree. How do we create a sense of urgency around this topic? And how do we moderate that? And especially when we are thinking about quality and cost, how do we reconcile all of that? So Dr. Paz, I'll let you please go first.
Yeah, so great. This is a great question. I really like this question a lot because it gets to so much of what we've been talking about. Yeah, so we rank among all OECD nations 13th, I believe, most recently in health outcomes. We spend, we're number one in spending on a per capita basis. We spend, as it said here, over 20% now of GDP, over $4 trillion. But here's the thing, and this gets back to what I mentioned earlier, and this incredible work of my friend Mike McGinnis and others on the determinants of health. And one of the things that they observed, and we've understood over the past couple of decades even better, is that healthcare per se attributes to about 20% of your health status. Health status being measured as dying a premature death and how you rate your own health and well-being. Another 10% is determined by genetics. The other 70% is determined by social determinants of health, so education, socioeconomic status, transportation, food insecurity, housing, racism, crime, violence, all those things. Actually, that's the largest. Behavioral determinants of health, so exercise, obesity, addiction to nicotine, opioids, alcohol, and then environmental determinants of health. And we've heard a lot, tragically, about climate change just in the past several years as one example. Air quality, water quality. This past year, almost 500,000 people died of smoking-related deaths. Smoking is down to now about 12.5% of the population. That's still tragic because almost 500,000 people have died of smoking-related death. That's a behavioral determinant of health. Before the pandemic, roughly about 70,000 Americans died of an opioid overdose. Tragically, after the pandemic, over 110,000 Americans died of an opioid overdose. Well over a third of the population has substantial obesity. Many people eat tremendously poor diets. Many people don't get any exercise. These are enormous contributors to health and well-being and premature death. we could literally double how much we spend on healthcare in this country and make it 8 trillion if you'd like. But if it only impacts 20% of overall health status, why are we surprised that we are where we are as a nation? The other countries in that OECD ranking also make substantial financial investments in those social, behavioral, and environmental determinants of health. And when you actually look at what we spend compared to many of them, they spend more when you add the two together. Part one. Second part of the question is about quality. The quality measures are very important to be proud of. There were observations made decades ago by people like Lucian Leap, Don Berwick, and others about the tragedy we have, this famous Institute of Medicine, now National Academy of Medicine report on crossing the quality chasm, the gaps that we had in quality at that time, the opportunities we still have today. And, you know, the observation was made, if in America, 2 747s crashed every single day, wouldn't somebody say something about that? So those were the observations made back then. We've made, I think, very important, and I think in many cases, incredible strides in improving quality of care in those settings that were defined. We still have enormous work to do, but a lot of progress has been made, and therefore a lot of those awards. But again, if we're only addressing 20% of the equation, why are we surprised that we have the health outcomes that we have? So I would say that that's where we are, and I think it speaks to the promise of thinking through what Zeev has called this massive transformation, because can we use this as an opportunity now to improve access to care, make care more affordable, and address the things that count as much, and in some cases even more, than simply healthcare per se.
Great. Thank you for those important insights. Zeev, what would you like to add to the conversation?
I think Dr. Paz really, hit the nail on the head. It is a very, very complex issue. I don't think you can point a finger at any one thing, but some things we do know, one of which is we spend less than 10% of all healthcare dollars on primary care and preventive care in this country, whereas other countries you see much more primary care, preventive care, public health care, social determinants of health care. So I think Dr. Paz is exactly right, that we if we're looking for a fix or a change or an inflection, it would be to divert some resources into primary care. It really is an inversion of the type of model that we should be having in the country. This is not to say that specialty care is not important, because that's obviously not true. But I think a greater focus on primary care, preventive care, the non-clinical or social determinants of health, as Dr. Paz was saying. Even things like disparities of care, we actually, and there was a study that was done just this past year that looked at the cost of disparities in care along racial lines is going to cost us in the hundreds of billions of dollars a year in the next few years. And so decreasing disparities of care, again, which speaks to really attending to the non-clinical determinants of health that Dr. Paz was articulating, including education and transportation and housing and employment, and basic, public health and preventive care. So I think it really is a shift of, when you get down to nuts and bolts, it's, we have to, as a country, make that shift and start putting some of the healthcare dollars in that domain. And it gets very, very granular. As Dr. Paz, as you were talking, I was thinking about even something like back pain. So, back pain is one of the most common problems, that folks come to their physicians and the employer healthcare space. It's one of the top 3 costs of care, musculoskeletal. And the typical protocol is, someone comes in, maybe they get an X-ray, they go get sent for an MRI, they go see a neurosurgeon. I mean, you could rack up a bill that is thousands and thousands of dollars very, very quickly. But we know from a evidence-based and clinical perspective, the probably better way to go is to send folks with back pain to a physical therapist, and have them have 2 or 3 or 4 visits, and generally speaking, again at a fraction of the cost, with better outcomes, and better customer patient experience. And so it's probably hundreds and hundreds of those types of clinical protocols that if we changed those, I think our costs would dramatically decrease. But I think your point, Dr. Paz, was the main point.
Yeah, thanks. Thank you. I appreciate that. We have several questions and we only have a few minutes left. So I'm going to try to quickly get some thoughts from the two of you on these. The first one I'd like to bring up is innovation in the healthcare education space. Is it really ready for disruption? So Dr. Paz, thoughts?
Yeah, and very quickly, I think one of the biggest opportunities that we have is to focus on interprofessional education. Still today, in large part, education occurs in silos: nursing schools, medical schools, pharmacy schools. I can go through the whole litany with you. And we often teach our students different care paths. We teach them somewhat different languages. And then when they graduate, we have to retrain them to work together effectively in teams. One of the biggest changes in healthcare over the past several decades is the move from individual providers to team-based care. That also obviously helps address workforce issues, reduces interoperability issues, a whole host of things. And of course, the burnout that Zeev mentioned earlier. So I think that's a huge area of focus for us here at Stony Brook University among our 5 health science schools. And I know that many other institutions are beginning that path as well.
Great. Thank you for that. Zeev, thoughts? Dr. Neuwirth, what are your thoughts around education and disruption?
Liz, I'm seeing all these questions. Maybe we could jump to another question.
Okay. All right, that's fine. Let's see. Let's talk about the blockbuster story and change. How do we shift mindsets? Zeev, what are your thoughts? You've done a lot of thought leadership on this and a lot of interviews. I'm curious to hear what you've learned through those.
Yeah, I think, again, it kind of goes back to, I think, what I was saying before. Change is very, very hard. And quite honestly, we've been in an era, at least through my career, it's been sort of a plateau. Like healthcare delivery hasn't really transformed all that much. And again, I'm not talking about medical science and clinical science and technology, huge transformations in actual treatment of care. But in terms of the delivery of care, I think we are again in that transformation. I think the blockbuster story and many other stories like that are the Kodak moment. We've talked about that for years. You don't want to be caught in the Kodak moment. And by the way, I wrote about this in the book on reframing. Kodak actually, people don't know this, but Kodak actually created the digital camera. It was one of their technologists and researchers came up with the digital camera, actually created the prototype, and they were developing it. So they were way ahead of everyone else. It wasn't that they were stupid, they had the technology, they had it done. They could have owned the digital market in cameras, but it was literally their leadership was just not ready to make that switch, and they were focused on an old business, which literally was paper. Their whole thing was they were selling the paper that photographs were made. They were making good margin on paper. And so they were like, we're not going to give up our good margin paper business for this digital thing, this digital camera thing. And they actually sold part of their patents away at a ridiculous, there was no price that could make up for it anyway. And so they went out of business. And I think that, the story for healthcare is really similar. We are married to, as Dr. Paz was saying before, a fee-for-service model. Decent margins. This is our battery pack. This is the plug that we're plugged into, just like Kodak was plugged into paper. And it's a very, very hard thing. And this is where I think we haven't talked about this, Liz, but this is one of the reasons I'm so excited to talk to you and to talk to Dr. Paz. The most important thing right now is leadership. Leadership requires us to look to the future, to be aware, to be discerning, and to make the tough decisions. And right now, that's what we need to do in our healthcare systems. we need to figure out, as Dr. Paz was alluding to before, how do we stop focusing on the paper business and how do we start focusing on the business of the future? Because it is very, very possible that we will, end up, and by the way, the one advantage all these disruptors have is they don't have a legacy business to worry about. We do. And again, it is what it is, but at the same time, we have to figure out how to make that leap. And again, I'm not saying it's easy. Leadership is really, really, really critical at this point in time. And by the way, as Dr. Paz was just saying before, it's not just one type of leadership. Leadership is a team sport at this point in time. Healthcare is too complicated for any one discipline, whether it be clinical or financial or operational or policy. We need to do this in sort of a leadership collaboration, if you will. I honestly, to be honest with you, Liz, I have not heard enough discussion about that around the country. I go to, I listen to conferences and talks and I hear a lot about a lot of things, but the one thing I don't hear about is the leadership, the type of leadership that is going to be required to bring us into the future. And it is really, really critical, not just for healthcare, but for our entire economy and our entire country.
Yeah, I love that concept. We've been talking about that with our life science schools and how do we create leadership in this next generation of workforce that we're trying to graduate and bring into the workforce. I know we're right at time, but there's one last question. And Dr. Paz, I'm going to ask you, with your experience in your career, you've worked for CVS, so you've got a lot of knowledge there. And we have someone who wants to know a little bit about retail healthcare providers and how do we choose the right healthcare retail platform to align with? So quick thoughts on that?
Well, I think it's what Zeev said earlier. It's all about trust and having a partner for your particular need. And it might be a segmented need. It might mean that for relatively simple types of healthcare needs, you have a certain partner in your community that you really trust. And I'll say that there are many individuals that have an enormous trust with their pharmacists. They have a great relationship with their pharmacists. And I think that is terrific because adherence to medication is one of the biggest challenges we have in this country for individuals with chronic illness. So having that relationship is exceptionally important. Having the opportunity to have bidirectional communication, to have health information that you believe and trust in, and people that you can relate to personally given your own circumstances. But then knowing that if that care is not adequate to meet your needs based on your condition, because maybe it's a serious illness or it's a chronic illness that is complex, that you have some place to go to have those needs addressed as well. And I hope as this transformation matures, those connection points will grow, the interoperability will grow, and we can come up with a holistic approach where each individual can create around them a set of solutions that meets and lets them achieve their aspirations for improved health and well-being.
Great. Those are wonderful closing thoughts. I really appreciate that. I'd like to take a moment. Dr. Neuwirth, it's always a pleasure to see you and talk with you. You have such great insights and a broad array of experiences across the healthcare ecosystem. Dr. Paz, again, much appreciated in terms of your thought leadership and helping bring us perspective on the history of healthcare and how that has transformed over time, and yet how we still need to continue to transform it. So thank you for those thoughts. And thank you to the audience that joined us today. We appreciate it. Zev, you asked a question about are we recording this? And we are. So we will make this available to others so they can listen in at another time. So thank you all so much. I appreciate it.
Thank you.